Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Uric acid stones. Uric acid stones constitute of around 5 to 10% of all kidney stones. The uric acid stones are the most common radiolucent urinary stones which are present. So radiolucent means they are not visible on X-ray. So radiolucency suggests that they are not visible on X-ray, and these uric acid stones are mainly formed in the acidic urine. So, uric acid stones, the causes or the risk factors of uric acid stones are: uric acid stones can occur in gout. Why? Gout is a state where there is increased uric acid. The uric acid production may be increased in the gout, or there can be decreased metabolism of uric acid. Thus, uric acid gets deposited in the joints, especially metatarsophalangeal joint in the gout. So, uric acid stones are common in gout. Uric acid stones can also occur in myeloproliferative disorders. In myeloproliferative disorders are nothing but where there is increased blood cells are produced. In these disorders, whenever there is increased blood cells are produced, there is also increased breakdown of blood cells will also occur. When the cells are broken down, the nucleotides gets metabolized, and this results in the formation of uric acid. So in myeloproliferative disorders, there is increased formation of uric acid is seen. Then Lesch-Nyhan syndrome or hyperuricemia. In Lesch-Nyhan syndrome or hyperuricemia also there is increased uric acid is seen. So whenever there are uric acid stones, then the management of uric acid stones is important. We should give the patient first, because the uric acid is formed from the purines. So you should ask the patient to take low purine diet, and you should ask the patient to take adequate hydration is required. And alkalinization of urine: when we alkalinize the urine, this alkalinized urine will flush out the uric acid, because alkalinized urine will keep the uric acid in ionic form so that it can be excreted. We can give the drug allopurinol. Allopurinol inhibits the conversion of hypoxanthine and xanthine to uric acid, and thus there is decreased production of uric acid in allopurinol. So you can use allopurinol in uric acid stone management. You can also use acetazolamide. Acetazolamide is added only if the urinary pH is less than 6.5, then you can add acetazolamide. Acetazolamide will help in excretion of the uric acid along with the water. Acetazolamide. What is acetazolamide? It is actually a carbonic anhydrase inhibitor. So it helps in diuresis.
thank you and thank you for watching.